As you know, this crisis jam is on deaf communities in 988. My name is Megan Haupt. I'm with the National Association of State Mental Health Program Directors. I'm Chief of Staff for NASMHPD. I am very excited that everybody could join us today. And let's just go to the next slide. Great. And this is so exciting because there's 64 national organizations that are part of this crisis jam. And I just want to note that the red states there are where the, I believe the Medicaid folks have joined from each of those states, and all the states have been joining. You'll see these small little kind of mustard circles. Those are also localities. And so if you aren't listed here and you're a locality or you're an organization and you're not listed, please let us know. We want everybody included on this map. And notice that there are also other countries. We have Australia, Canada, Netherlands, UK, lots and lots of participation. And one of the highest participation times, we had 404 people, and we have 2,772 on the newsletter email list. Very exciting, great participation. I look at this crisis jam as the go-to on crisis services. So let's go to the next slide. Okay, great. And to get the materials and access the link and so forth, you go to the Crisis Talk Learning Community page here, and it has that information. And let's go to the next slide. Great. Yeah, here are some of the recent crisis jam highlights. So you can get the quotes, the past crisis trivia hot seats, some of the state cards on who has really done robust legislation in states, and the featured presentations, of course. Next slide. Great. And this is the latest crisis news, the CNN article. This is the mental health groups expressed concern about readiness of new suicide prevention hotline. Now, why is this different? We see a lot of these articles right now. The reason this is different is because a number of the folks on this crisis jam are quoted in this article. Hannah from NAMI, John Draper from Vibrant Emotional Health, John Palmieri from SAMHSA, are all quoted. So that's very encouraging. Some local call centers are highlighted. This is a really great article, so we're excited for that. Although the title sounds what it is, I think it's a very positive thing that our community is included in this. And just next slide. Great. And this is highlighting the 988 Day of Visibility from NAMI. And this is very positive. What's so wonderful, as you know from the previous slide, there are many articles that talk about, are states ready? Is everybody ready? This is more like a launching. It's the beginning. We're at the starting line. And so it's much more positive experience. So we're really, really wonderful about that positive, that it's only a beginning at that launch. Are Stephanie or Hannah on at all that would want to make some comments on that? I'm not sure. Okay, we'll move on. That's fine. And okay, next slide. And great. This is on July 13th at 12 noon. There'll be the jam session by Dr. Miriam Delphin-Rittman, who's the Assistant Secretary for Mental Health and Substance Use. That is very, very exciting. And we are just delighted for Dr. Delphin-Rittman's leadership and SAMHSA's leadership on this. And that'll be hosted by David Covington, who's the president and CEO of RI International and hosted this many times and runs it behind the scenes. He's fantastic. Let's move to the next slide. Great. And this is today's quote. And this is from Steve Hammerdinger, who is a national leader in deaf mental health services, and he is also the state director for deaf services and mental health in the state of Alabama. Steve Hammerdinger has been an amazing mentor for me, and I just so appreciate him. His quote is, "We need immediate access to a call counselor who is ASL fluent." And that came from the article he was involved with from our Crisis Talk article about a month and a half ago. And moving to the next slide. Great, and we're now going to move to our featured presentation. I am so honored to introduce Holly Rioux, who is a licensed independent clinical social worker. She is the Director of Deaf Services and Language Access at Greater Nashua Mental Health in New Hampshire. I'm going to turn this over to Holly. Thank you.
Hello, everyone. So I also have my staff interpreter here from Greater Nashua Mental Health. This is Kelly's voice you're hearing. So thank you for joining me. And I'll go ahead and introduce myself a little bit. I'm a deaf clinical mental health social worker, and I've been working here at Greater Nashua Mental Health for 12 years. I started as a case manager, and then I've been here through my whole journey through grad school, and now I'm the director of the statewide deaf mental health services program here. Next slide, please. Okay, so here in the state of New Hampshire, we have 10 regional community mental health centers, and they are independently contracted with the state Board of Mental Health. So we, instead of having a deaf specialist mental health team at each of the 10 regional areas, we have one statewide deaf mental health team here at Greater Nashua. And we're contracted to provide statewide mental health services to the entire state of New Hampshire for the deaf and hard of hearing community. And this also leads to us being the go-to providers for discussions about best practices in our system. We have a team of 9 individuals right now, so we've grown a lot since I started here. 5 of us are deaf social workers. There are 2 case managers at the bachelor's level. And we also have sign-supported employment specialist. And then we also have our staff ASL interpreter. Next slide, please. So if you find an opportunity to read the recommendations from the National Agency of State Mental Health Program Department or Directors, that publication is written by an experienced clinician who's been working in deaf mental health services for over 30 years. And so our team is like the second generation of deaf mental health specialists. And it was the first generation who wrote this publication. And it includes goals for how our program in the state of New Hampshire can follow their recommendations, and also what challenges we have. So I want to clarify what the slide says when it says veterans. It's the deaf mental health specialists, not actual military people. So, and really they have 3 simple recommendations for implementing deaf and hard of hearing services. Next slide, please, for the 3 recommendations. And in the chat, you can also see the PDF as well. So the first recommendation that we will talk about more later, but it's establish a nationwide call center. And the call center will be staffed by mental health specialists who are deaf and hard of hearing or skilled at working with the deaf and hard of hearing population. The second recommendation is something that we already have, and that's crisis helpline. We want to see that happen nationwide, and we'll talk about that more later as well. But the second recommendation is to set up a system to make sure that our deaf and hard of hearing community is able to receive follow-up care. So we really need a good system to show where they can go for good follow-up care after the crisis is resolved. The third recommendation is that each state should have a statewide mental health coordinator for deaf and hard of hearing community. And in the state of New Hampshire, that's me. So some states have a state department for services for the deaf and hard of hearing community. And sometimes those directors are actually state employees. In other states, they have private programs that are funded through the state. And here in New Hampshire, we have funding from the state since 1994. So either they recommend that either state has their own coordinator that will help lead to number two, the improvement mechanisms. Because the nationwide call center can contact the state coordinator to develop a coordinator relationship, and the state coordinator can help the community of their state get the services they need. Next slide, please. So talking about why would we need one national call center? The publication expands on this more with research and statistics and resources, but generally speaking, most states don't have a very good network of deaf or signing counselors in each state that can provide 24/7 coverage. But nationwide, there's many of us. There are 5 in New Hampshire, and there are many in Massachusetts, many in Alabama, many in Minnesota. So we're all over. And if it's nationwide, then we can volunteer or work different shifts or set up that system to support the call center. So that means that we would use the current structure that we have to support the call center and better meet the needs of the community nationwide, because they're all over the country and we can access them by video. And the second reason, of course, is to save lives. And the way that we do that is to make sure that the people that are taking the calls are ready to work with different people and understand their stressors, understand their daily experiences, understand their frustrations. They're living in a hearing world, and also understand what solutions different deaf people can use for various communications. Because if there's just getting a hearing caller, or if they're just being sent to a hearing caller from a regular call agency and they don't understand how VRS works, they could get hung up on, and different other problems. And so if we contract with people who are mental health aware and also deaf or hard of hearing themselves, then they get more support and more of the services they need, and it's possible to continue that system. And then the third reason that we're having issues with data collection. Each state is trying to track how many deaf people are calling, and it varies. And there are really 50 different approaches for each of the 50 different states. So having a central approach would have one way to collect the data, and then we can learn more about what the deaf and hard of hearing community needs. And that will increase our understanding of what the population needs as well. Next slide, please. Many people nationally will think that, oh, texting and chat are great. And so many states do offer that, but not all of them. Some people have text 911 as well. Some people know the National Hotline for Suicide Prevention also has a chat line. And so there's many positives to having a chat, including making safe calls without sounds. Some people don't have the ability to speak. And there are many reasons why people benefit from text and chat modes of communication. But there's also many reasons why text and chat are not satisfactory for deaf people. And part of that includes the fact that many of the deaf and hard of hearing population are not proficient in English, unfortunately. So first, we all assume that the proficiency in any language is the same. And that's just not the case. Our proficiency is fluid. And it changes based on our stress levels. And so if our stress is high, our ability to access our second or even potentially third language looks very different for communication strategies. And that can be a challenge. And there's a lot of room for error in that. Second, we're also assuming that all of our workers who work on the chat lane are specialized to understand the needs and communications of the deaf and hard of hearing community, and that's just not true. So, and a lot of our deaf and hard of hearing community experiences barriers with communication and also not having culturally sensitive support. So the stress goes up from those experiences of making those calls. Next slide, please. So what have we been doing in New Hampshire so far, you might ask? We still have a lot of work to do, but we're unique in that we already have a team who are able to provide mental health services to the community. So we already know that 988 doesn't need to be intended to be the whole part of mental health services for the deaf and hard of hearing community. It's just one small part of lifelong care. And so for now, and many years, we've had a seat at the table for the whole state meeting. And one benefit of having a seat at the table for the state meeting is that we can go and be included in the state conversations. We're included in planning and implementation and also information dissemination. And we also get to make our colleagues aware of the deaf and hard of hearing community struggles and needs. So having ongoing and regular conversations with our local area resources is beneficial, as well as having a national call center. And so developing relationships with coordinators for everyone who would be involved in that would be great too. And of course, we still need to do more. So for community engagement, I encourage the community who don't understand what 9-8 is to go and look into it. There's also the social work team here that can help facilitate community listening sessions for this targeted population. And we'll continue taking that approach because we get good feedback from it. And so second, we want to make sure that our sister organizations and any other organizations that serve our population are aware and can spread the word too. And also we're raising awareness to what we need as a community. Next slide, please. So while we advocate for a national call center that we don't have yet, we also need to understand that this is just temporary too. So in the meantime, while we're waiting for the national call center, we need to provide education for different deaf perspectives and deaf approaches that can best facilitate helping people to get through their crisis, and make sure they're aware of our programs to connect them to, for call centers to refer out for post-crisis interventions. And we also have a rapid response team here in New Hampshire we fondly refer to as the mobile crisis team. So we provide education and training to them as well. It's very burdensome to do all of this activity at the same time and re-educate and address staff turnover and keep information updated, all while everything changes. And it's not a perfect system. We're aware the calls are still getting dropped, the ball is still getting dropped, people are getting lost in the cracks. But so there's a lot to do while we wait for the National Call Center, but we're working on it. And this is also matches the recommendations from the Association of the State Mental Health Project Directors. Next slide, please. So current challenges with what we're working on right now, again, is advocating for one national call center for many reasons. We're trying to consider, the state of New Hampshire is trying to consider an independent contract with providers that can provide access and that kind of support. But that provider is not necessarily able to manage all 50 states. So that's not the solution, and we know that. There are different and better solutions out there. So we're advocating for that. And I think the rest of the system has issues with area codes as well. So the deaf community has the same issue with area codes. And that's, we don't all have the same area code where we live. Since most people have cell phones, now they'll have one phone from. So what happened in New Hampshire was the FCC ran out of 603 phone numbers. So now people are getting phone numbers from Maine, Massachusetts, and Vermont, our neighbors. And so I recognize, as the statewide mental health program coordinator for deaf and hard of hearing services, having a seat at the table, I have the privilege to bring this up. I'm going to see if there's any questions in the chat right now, real quick. So the question is related to the process. So right now, we're just trying to gather voices and information and data so that we can advocate for more states to scream and say, hey, we need a national call center for the deaf and hard of hearing community, because each state needs to be honest with themselves about their ability to functionally serve their community. And if they can't, then that is obviously supporting a need for a national call center. I think that's almost my time. The next slide, please. And so I just need to clarify one thing for the interpreter about area codes. So if we could just back up to that last slide really quick. So the reasons why the area codes are a challenge is because right now the technology says that the call center will be directed to the location of the area code. So that means it's not automatically directed to a New Hampshire caller. And that would be the same problem nationwide as well. And so that's not just us, it's the whole deaf and hard of hearing community. All right, so that's my time, and I'll turn it back to Megan now.
Holly, you are so wonderful. Thank you so very much for your presentation. Thank you for highlighting the NASMHPD recommendations. As you pointed out, they were developed by the deaf community leaders that have been in the field for a very long time, as you called them, veterans, and we're now the next generation building on their expertise. And we are so grateful to them. Steve Hammerdinger, Neil Glickman, Roger Williams, among many others. So Holly, I see you as that next generation. So I'm just so grateful to you. And I see a lot of comments in the chat box. Will the PowerPoint be available? Yes, it will. At the beginning of the Crisis Jam, we showed the page where you can get that. And so perhaps Karen can put that link in the chat box so that everybody has access to this in a few days. I did want to just note a couple of things. At the end there, you saw the interpreter and Holly clarify. Holly and Kelly know each other very well. They work as a team. Even with them knowing each other well, and Kelly interpreting and doing Holly's voice, there's still clarification that's needed. If you can imagine what it would be like for a deaf person who is in a lot of stress, calling somebody randomly, the crisis line, using a video relay service, using that interpreter who isn't necessarily trained in crisis, doesn't know the individual, and how difficult that might be for the person who is deaf, trying to convey distress and not knowing that that interpreter is actually conveying the information correctly. As you saw in Holly's slides, poor communication and cultural insensitivity increase hopelessness. So this is another reason why we want a national center that has ASL fluent crisis counselors. So I did want to just, before we get to the roundtable, I want to call on Stephanie Logan. Stephanie is, she runs Deaf Lead. Deaf Lead does ASL fluent counselors for the Disaster Distress Helpline, and she also is a national chat text backup, and among other roles as well as in Missouri. So Stephanie, could you just give us your thoughts on the presentation, if you would? Stephanie Logan.
Yeah, hi, sorry. I was trying to open my camera and Stephanie is frozen for the interpreter. Okay, freezing. Okay, I'm freezing. Okay, you're back. Go.
You're good.
I got you. All right, cool. So hi, everybody. Thank you so much. I have been here for 27 years at Deaf Lead. Long time. I am deaf. And I became deaf, and she's frozen from meningitis as a child. So I never, and she's frozen.
Yeah, I'm gonna go ahead and voice. And you can go ahead and interpret for me. This is a really good example. I'll stop signing that Megan was talking about. So I'm deaf. I lost my hearing when I was 23 years old to spinal meningitis. And Terry doesn't know me. Terry is an interpreter, doesn't know me, and she's outstanding. But it is very challenging for an interpreter to voice interpreter for a deaf individual that they don't work with on a regular basis. So when a deaf person calls through their video phone to a hearing crisis line, so if they were to call on July 16th, 988, they'd be using their video phone, and an interpreter would be interpreting what they see that individual signing. When they're in crisis, even when we're not in crisis, it can be challenging to voice interpret for a deaf individual that you don't know. And you can be the most amazing ASL interpreter ever. And so that is one of the great things about having a video phone crisis line where there are deaf individuals fluent in American Sign Language and other sign systems to be able to communicate with the deaf individual directly. That's what we do at Deaf Lead. So we operate the Deaf Crisis Line, which we've been doing since October of 2017, which is for deaf victims of crime. Any deaf individual who has any kind of emotional, physical, or sexual abuse in their lifetime can call the Deaf Crisis Line. And that was a dream of mine over 27 years ago, that I wanted to have a crisis line for the deaf community, because it's what I needed when I lost my hearing. We established a TTY line, and as most of you may be aware, is fairly archaic now. A video phone is the method of communication. And so I really wanted to transfer our TTY line to a video phone crisis line, which we did in October of 2017. Through that, we established a relationship with Vibrant for TTY services because they needed it. And I started immediately talking about the need for video phone services, but the funding just wasn't available until the pandemic hit. And when the pandemic hit, funding became available for the disaster distress helpline. So Deaf Lead has been providing a national video phone crisis line for the disaster distress helpline since the pandemic hit, which has really served as a model for the 988 video phone crisis line. Vibrant is very motivated, very highly motivated to establish a 988 video phone crisis line. So in answer, all of this was in answer to Holly's presentation. Will there be a national call center? Yes, I believe there will be. The beginning stages of implementation of that, based upon the DDHVP, is in process. There are things way outside of my pay grade related to the FCC and the platform that we utilize through communication services for the deaf, that kind of thing, that still have to be addressed. But there will be, I believe, I can say that it's again not my decision, but I know that 988 that Vibrant is highly motivated to have a 988 VP national call center.
Stephanie, thank you very, very much. We're so glad you were on the call. You do fantastic work, and thank you for all that you do. I'm going to turn this over for 2 minutes to David Kingsbury and Michelle Niehaus. Both of them were involved in developing the NASMHPD recommendations. They are the veterans involved in really establishing deaf services and what they should look like. David Kingsbury is from Missouri and Michelle Niehaus is from Kentucky. David, if you could just take a minute and tell us your thoughts.
Sure. Well, I'm so excited about this presentation, that this information is being shared and that different states are working on this. And that there's progress on establishing the national call center as well. You know, there are so many reasons that this is important. Some of those reasons are summarized in the NASMHPD document, and we could spend hours explaining all of the reasons this is the best way to provide crisis services to the deaf community. But at the end of the day, this is about equity. When a deaf person is in crisis, do they have access to the same type of experience in reaching out to and receiving support from a crisis worker that a hearing person has? And that's why this is so critical.
David, thank you. I'm going to move to Michelle Niehaus. Michelle, what are your thoughts, please?
Well, first of all, thank you so much for hosting this discussion and for having Holly as the lead, because I think it's incredibly critical that we look to deaf individuals as the leads and what this needs to look like for the deaf community. As she was talking, and then as Dr. Logan came on, Dr. Logan was one of my mentors, and I think about how we're building a system of care based on the work of decades of struggle from the deaf community. It shouldn't have taken 27 years to get us to a point where we're talking about direct services, where a person has immediate access to a signing clinician who has the cultural knowledge and who has the clinical knowledge to do everything that a hearing person would need in the same situation. So as we look at evolving our services, I think about teaching and learning from the deaf individuals who are doing the work, thinking about the lived experiences of people who have called crisis lines and had bad experiences versus those who had good experiences, and thinking about how we can leverage technology and what we learned during COVID to move us forward. It's often said that deaf mental health services can be 20 years behind the hearing world, and we don't want that to be the truth anymore. So by establishing a national hotline and having that staffed by people with the clinical and cultural skills and the linguistic skills, we really can create a more equitable system of care for folks. If we don't do that, we're in danger of re-traumatizing individuals. And I think that by creating our national network, we can also maximize our workforce, like Holly said, and by having those folks connected to one another, like Stephanie has done with Deaf Lead, they can also support one another, because we know that one of our capacity concerns is that people will experience secondary traumatic stress. So we need our call center folks to be able to support one another so that they can sustain the work over time. This is really life-saving work on the individual level, and it's an opportunity to really help the deaf community move forward and to use the expertise that's always been there where the support maybe hasn't been. So I look forward to seeing what the data collection piece can do and what we can do together to move deaf mental health services forward through a national call center.
Fantastic, Michelle. Thank you so much. Thank you to Holly and David, Michelle, and Stephanie for contributing so much to this presentation. We are going to move to the next segment. Thank you so much, all of you. And this is the Crisis Jam t-shirt. So if you are on the hot seat or you host, you get a t-shirt. I've actually ordered my t-shirt. I'm very excited about this because I've been on the hot seat before. So the wonderful thing is you get to choose the logo you want, you get to choose the quote you want, and really personalize it for yourself. If we can have the next slide, please. Great, and we're on the Crisis Trivia hot seat. I am going to call on Suzanne Robideau. Am I saying that right? Rabideau. Hey, how are you?
Good.
Great, great. So so glad that you can join us today. I just want you to know, of course, you will get this t-shirt even if you mess up. Okay, like
Okay.
don't worry. Okay, you get the t-shirt. Okay.
But good, because I've been working half of my career in crisis services, and I've learned more in this hour about what the needs are. And Holly, thank you so much for your clarity on the roadmap. This is about equity and cultural competence, and thank you, Holly. Let's look at the trivia, because I probably won't get it right, but
All right,
I'm looking forward to my t-shirt.
I think you're going to love it. So the Access SOS website states 37 million Americans can't hear or speak out loud. CEO and founder Gabriella Wong tells the story of her father texting her to call 911 for him after an accident. According to Access SOS, what percentage of 911 call centers can't receive text? So, Suzanne, the audience is going to put what their answer is, and submit that, and you can answer. Yeah, What's
Can
it-
I ask either Dr. Logan, Holly, or Michelle for what they think the answer is?
I think that's a great idea. You can absolutely call a friend. You can go by.
They're my new friends.
Okay,
They're my
great.
new
Who
lifeline.
do you want to call on?
How about Dr. Logan?
Okay, great. Dr. Logan, what is your
What's your
response to
answer?
this question?
Okay, I say 30%.
Okay.
That's my guess.
I'm gonna go with that. I know the audience said 70, but I'm gonna go with 30.
All right. Are you sure? You still get the t-shirt.
Oh my gosh. I'll take quote number 4 on the t-shirt.
All right. So what's so surprising about this, that is just astounding, is that it's so high. We would think we would be able to really handle this at this point. So Access SOS is on a mission to make emergency help accessible. Their vision is communication access for all. And if you enter just a few details of the emergency, they contact 911 for you. So according to Access SOS, what percentage of 911 call centers can't receive text? 70%.
Okay,
So yeah,
I should have read the question. I thought it was who can receive text. So 30%. Anyways, but Dr. Logan, thank you for your help.
all right. Just to tell you, I got it wrong when we were practicing this. So, but the point is to educate. So this is fantastic.
Exactly.
Suzanne, thank you very much. And also just to let you know, Gabriella Wong will be on a future call doing a presentation. So very excited for that. So I'm now let's go to the next slide. Great. And I'm gonna call on Stephanie Hepburn, please.
Thanks, Megan. So I'm going to welcome Tiffany Russell. She's the former project director of mental health and justice partnerships at the Pew Charitable Trust. Tiffany, if you're on the call, can you share a little bit about what you noticed when interviewing leadership at 911 call centers that were affiliated with the Safety and Justice Challenge?
Hi, Stephanie. Thanks so much for having me today. This particular research was done a little over a year ago. So I'm really hopeful that the conversation is a lot different right now. But I know that when we were interviewing PSAP community leaders, we were learning that the conversation around 988 and 911 was not happening. It was very siloed. Behavioral health community really led those conversations and didn't really involve 911 call center leadership in those conversations. The difference that we saw between 911 call centers that are involved are part of a community that are part of the Safety and Justice Challenge sites with MacArthur Foundation, we found that they were a little bit different from other 911 call centers because they already share this collaboration or sense of collaboration around data. They have more open conversations. So they are more likely to have this very open collaboration about sharing data, sharing information, working together. And that puts them well ahead of a lot of communities because they do share this kind of information. So your 911 call centers are sharing information with law enforcement and behavioral health providers, and they're able to make really sound decisions are based on data and not anecdotally. And that's a lot more helpful to community leaders to have that data to make those big decisions like that.
And you mentioned, partnership is instrumental for all of what you just stated, but you also said it helps to build trust. Can you explain a little bit about when we talk about diverting from law enforcement, why is trust so very crucial?
Well, I think, most community leaders or city, state leaders are definitely looking to avoid risk. And when they're making large decisions or when they're changing systems, they're averse to risk. And so having the ability to trust your partners can only happen when you're sharing information alike, and you're sharing your mistakes, and you're sharing the things that you're doing right and the things that you are getting done within this system. And so when you can build that trust to say amongst your partners that we're not pointing our finger at any one group of people, that we're trying to do this as a group, and we want to be successful as a group, it's really helpful to have trust amongst those partners. And you really can only do that when you're open and you're sharing information, you're sharing data together and with each other. And when you can build out that trust, that's when you can do a lot around systems change, because it really does start with the trust between those partners.
Thank you. And I think the one last part was one of the leaders that you interviewed, when they were talking about data collection, they mentioned how crucial having a data analyst is at the 911 call centers, not only to look at 911 call data, but you mentioned also data from jails and other groups. Can you talk very briefly about that?
Yeah, we specifically had one of our survey participants, or questionnaire participants, specifically put in the comments that systems should hire a data analyst to help with doing this work. When you're thinking about changing a system, when you're thinking about adding more data collection, what we notice is that a lot of people don't necessarily add the people needed to analyze the data that they're collecting now. And you have to remember that a lot of us, especially in government systems, are already wearing multiple hats. A data analyst is typically not a hat that most people can just kind of put on easily.
Yeah.
And so you really do want to get someone that is very in tune and adept in analyzing very difficult data, because 911 call center data is not easy to analyze and interpret, nor is jail or criminal justice system data. And I think the same could be said about healthcare data as well. And so you really need someone that is not only trained in that, but is able to interpret what the data that they're reading actually means, so that they can inform the changes that need to actually happen in the system, and be able to share that information, and that the information that comes from the data with the partners involved in the system.
Thank you so much for hopping on the call, Tiffany.
Sure. Thank you for having me.
Thank you.
Thank you, Stephanie and Tiffany. And I do want to note that Tina Orwell from Washington says, we are marrying our 911 and 988 and establishing a close working relationship. We are working on co-locating some of our 988 staff at 911 call centers, and joint training will be important too. So thank you so much for that comment. Let's go to the next slide. Great. And we've got the SAMHSA update. I'm going to turn this over to John Palmieri, please.
Thanks, Megan. Appreciate coming on the heels of the conversation with Tiffany, speaking on 911-988 collaboration, recognizing that both the trust issue that she referenced and the details regarding analytics are both critically important to the success of that collaboration, and also very appreciative of the innovation that's happening across the country in Washington and other localities to support that coordination. And related to that, I just wanted to provide an update that we are in the middle of a 5-state policy academy, where I believe Richard McKeon and James Wright are actually participating currently, supporting some of that work, developing guidance, protocols, best practices, alignment on how states are approaching that collaboration. So appreciative of the 5 states that are participating in this academy: California, Colorado, Georgia, Maine, and Minnesota. That's happening today and tomorrow. And then obviously a lot more activity happening in the 911-988 coordination space, which is going to be critical to the success of implementation. And then the other thing I just wanted to flag is awareness of gun safety legislation proposed, which potentially could provide some additional resources for the Lifeline, and we're tracking that, and we'll continue to follow that moving forward. And so I think I'm just going to pass it off. I don't think Richard's on the call today, so I'm going to pass it back to you, Megan.
Great. Thank you so much, John. I am now going to turn it over to Amy Brinkley from NASMHPD to talk about what NASMHPD is doing with troopers.
Hello, everyone. Such a great conversation so far, and thank you so much to all of the speakers who spoke today, and thank you, Megan and Dr. Hepburn, for inviting me. So I'm an employee with NASHPD, and I currently serve as the Recovery Support Systems Coordinator. I'm also a person in long-term mental health and substance use recovery. By the grace of God, I celebrated 13 years in continuous recovery on April 3rd of this year. I've been with NASHPD now since January and previously served as Director of Recovery Support Services for the state of Indiana, the last 5 years overseeing our peer and recovery support services across the state. So I just want to note quickly that SAMHSA and NASHPD's Crisis 988 playbooks reference and recommend the integration of peers across the crisis continuum, which we all know, but I want to highlight that this includes peers being integrated into the somewhere to go, someone to call, and the someone to respond. So we are seeing variations of this being implemented across the states to various degrees. For example, peers are answering crisis line calls, peers are on mobile crisis teams, peers are within crisis stabilization units. Some states are focusing on 1 or 2 areas, and some are doing all 3 very well. People with lived experience bring the trusted relationship and engagement needed during times of crisis. So for purposes of today's conversation, I want to note and recommend that states review that peer section of the crisis playbooks that SAMHSA and NASHPD partnered on developing. And please look for ways to implement and or expand peer integration across your crisis systems. Felony background barriers have also been frequently coming up in state calls as well. So please be aware that peers bring so much to the table and may need some grace in getting employed, and that's worth noting today as well. So one other thing worth noting is Megan and I have discussed the opportunity for deaf peer services to be implemented in states. So there is wide open space for this to be a focus within states, especially as crisis services roll out. And we want to ensure that peer support is offered to people with hearing loss as well. So someone noted on another call just this week how much more difficult it was for people experiencing hearing loss to communicate during COVID because of masks. So there are a lot of unseen barriers facing the deaf and hard of hearing community. So including them in the process of developing crisis services is crucial, which we're doing here today. So kudos to us. So that's my nugget for today, and I will pass it back to Megan.
Thank you so much, Amy. And for all of your work. You can see the chat just acknowledging all the great things that you are doing. And if we have the next slide, please. Great. And I'm going to call on Sarah Corcoran.
Thank you, Megan. If we can go to the next slide, I'll give a quick approps update. Okay, so on this left-hand side for FY23, tomorrow, the House Appropriations, Labor, and Health and Human Services subcommittee will be marking up their FY23 spending bill. So we expect to see the bill text sometime today, if not tomorrow, leading up to the hearing. I'm sorry, to the markup. And then next Thursday will be the full committee markup. And in advance of that, we'll be able to see the committee report language that will give some more details on what the House has slated for their FY23 spending. And then on the House Energy and Commerce Committee, the Rules Committee in the House yesterday had their meeting on the mental health and HRSA bill that came out of the Energy and Commerce Committee. It should be on the House floor today. We are still waiting on the Senate Help Committee for a draft of their bill and for them to continue their reauthorization process for SAMHSA and HRSA. But those are underway in both the House and Senate, and the House is, quickly advancing their version of the bill. I'm going to turn it over to Bill from AFSP to talk about the new bipartisan package coming out of the Senate.
Thanks, Sarah. We have some good news that came out of DC last night. The Bipartisan Safer Communities Act looks likely to pass the Congress by this Saturday. This is the result of bipartisan negotiations that have been going on between groups led by Senator Murphy and Senator Cornyn. This is not solely a gun safety package. This also has significant provisions for mental health. The Senate voted last night 64-34 for it to proceed to formal debate. The fact that it's cleared the 60 vote threshold indicates it's very likely to pass the Senate. We expect it to pass the Senate on Thursday and then again likely to pass the House by Saturday. All of this could change. All of this is subject to change, but as of right now, the bill text includes well over $2.5 billion in additional funding for mental health. This is emergency funding, so it's in addition to what's already been appropriated for FY22. And several of these provisions are for later periods, whether that's FY23 or later fiscal years. For our purposes, maybe the most significant provision is that it includes $150 million in emergency funding for the Lifeline and for 988 for FY22. It also expands the mental health block grant program with $250 million in additional funding for the mental health block grant program for the period covering FY22 to FY25. Also includes $500 million for the school-based mental health services grant program, another $500 million for the school-based mental health services professional demonstration grant program, as well as significant provisions for several other programs. In the interest of time, I won't go into all of them here, but just wanted to bring it to everyone's attention. The bill text was only released last night, so I think all of us are probably going through the text and doing a more thorough read on all of this, but generally the mental health provisions look very strong in this. So with that, I'll pass it back over to Megan.
Thank you so much, Bill. And if we could go to the next slide. And Sarah and Bill, I just want to thank you for all of your work. Sarah is just vigilant about everything. You are as well. It's just really, really good. I'm going to now turn it over to Shelley Polanco from Vibrant Emotional Health.
Just a quick update on California. AB 988 has a new version of the text, and which would lower the fee amount to a 30-cent cap. And they have a hearing for the bill next week. Stephanie, you're on.
Yeah, thanks, Shelley. Just one other quick update in Massachusetts. Shout out to NAMI Massachusetts for this update, but there's a new bill there, H 4879, which is the House companion of the Addressing Barriers to Care, or ABC 2.0 bill. So that's a wide-ranging mental health reform bill, but if you look in at section 4, there are some 988 provisions. Just one highlight within that is the creation of a state 988 commission to help with implementation. And importantly, that requires peer and family member representation on that commission, which is great to see. And I'll also just add back to California, there is a hearing on that bill, AB 988, next week on the 28th at noon Eastern time.
Great. Thank you so much, Shelley and Stephanie. And if we could just go to the next slide. And these are the state cards. There were 4 states that have robust legislation. Karen, if you could just keep going through them. Virginia, Utah, and then Nevada, Washington, all have that robust legislation. So when you were looking at the map that Shelley and Stephanie were referring to, they were the ones that had kind of that mustard color. So we can learn from them. So fantastic. Let's go to the next slide, please. Great. And this is Moving America's Soul on Suicide, episode 7. And this will be Craig Miller, who wrote the book, This Is How It Feels. Other episodes, I believe 6, 7, and 8 are about to be released. And Kana Enomoto and her daughter, Raina Chang, will be on episode 6. Very moving story. So we really honor all of these very moving stories and of resiliency. And moving to the next slide, please. Great. And so we have our upcoming presentations. The next Crisis Jam will be Dr. Matthew Goldman, Homelessness and Crisis. And Representative Tina Orwell will be talking about an update on 988 from Washington State. She's already commented in the chat about the 988 and 911 relationship. We really appreciate that. And July 13th will be Dr. Miriam Dufflin-Whitman on about 988 Goes Live. So we are very excited for all of these presentations and just really appreciate everybody joining today. And let's see, let's go to the next slide. Is that the end? That is the Crisis Jam session. Thank you, everybody, for joining. Fantastic presentations. Thank you, everybody. Have a great afternoon.